Child rescue breathing. We're going to, as always, make sure the scene is safe. We're going to have our PPE, personal protective equipment, gloves. If we have a mask with a one-way valve provided, we'll also use this. At this time, we're going to check the carotid artery. I can see by following the jugular, taking 2 fingers down between the muscle where the carotid is, and that I have a very faint pulse. So at this time I'm going to reposition, just tilt the head back slightly. This opens up that carotid artery. I can see now that I have a pretty good carotid pulse, but the patient is not breathing, or the patient is not breathing normally. So I'm going to begin rescue breaths. I'm going to give 1 breath every 3 seconds for 2 minutes. At the end of that time, I will reassess to check for a carotid pulse. So, as always, head tilt, chin lift, squeeze the nose, look down for rise and fall of the chest, open up the mouth. You're going to give 1, 2, 3. I can see that the airway, the breaths are going in. Now, I'm going to do this for the next 2 minutes, giving 1 breath every 3 seconds. So you can imagine 1001, 1002, 1003, you at minimum have to give 1 breath during this time. After a 2-minute period, use your best judgment. You want to reassess and check for that carotid pulse. Once you get a strong pulse, and once you get breathing back, then you can stay by the patient's side. But as always, continue care until EMS arrives on scene. We're going to find the jugular or the Adam's apple. You're going to take your 2 fingers and you're going to move down the neck. There's a fatty muscle area that you're going to get your fingers in where the carotid artery will be. The carotid artery is a very strong pulse, especially on adults. If you get your fingers in there good, you got enough area on the adult neck, you're going to feel that pulse. Sometimes that pulse can be very weak. In this case, we could tilt the head back and some, opening up the carotid. Sometimes you'll get an increase on the pulse at this time. But you may have a strong pulse, but the victim may not be breathing. So you will still have to continue on with rescue breaths. As you continue with these rescue breaths, you're going to do the head tilt, chin lift, pinch off the nose, and give 2